Uh, so in today's topic, today we're going to study about the various color vial and what are the various anticoagulants. So let us study about it. So you can see in this image, usually in clinicals, we encounter various color vials. So we are really confused in the starting first year of nursing in which vial which sample has to be sent and what are the anticoagulants. So let us see the vials which is depicted in this picture. So we will study one by one. The first vial you can see the color code is red. Usually there is no anticoagulant in this vial, and the samples which are sent is serological sample and biochemistry. Like for example, we are having LFT, that is known as a liver function test. We are RFT, which is known as a renal function test and all. So these samples are usually sent in the red vial, and there is a no anticoagulant in this vial. Liver function test and renal function test. Next vial you can see is the gray vial, and which consists of an anticoagulant which is known as the sodium fluoride, and this gray vial helps us to know the glucose estimation. The third vial is a purple vial color, and it has an anticoagulant which is known as EDTA. The full form of EDTA is ethylene diamine tetraacetate. And this is one of the important vial usually you will encounter in your hospital setup, and is helpful in sending the hemoglobin level and complete CBC counts. And again, this is the purple vial, and the anticoagulant is sodium citrate, and all the coagulation profile is sent into the blue vial. So let us recall once again, this is a blue vial, which is a purple vial, and this is a blue vial. So in this we are sending the coagulation profile. So what is a coagulation profile? The coagulation profile, which is we want to know any kind of bleeding disorder the patient is having or not. For that we should know all the clotting time of a patient. In blue vial we will send all this PT time, clotting time. This blue vial will help us, and it has an anticoagulant which is a citrate. The next vial is a purple vial, which is helpful to know the complete CBC count. Any CBC complete count, to know the hemoglobin, to know the morphological structure of the RBCs. The vial, purple vial will be helpful. So the complete CBC you can see count. You must have seen these reports many times. So it is sent in this purple vial. ESR level, everything is helpful. Next is the last one is gray vial, which is helpful to the sugar, whether the patient is having any sugar related problem, the levels are high or low. So diabetes disease condition, again the sample which is known as OGTT, which is carried out in pregnant women. So in these gray vial we can see send the samples related to know the blood glucose level of the patient. So thank you so much.